The number one reason most people avoid the dentist is the fear of possible pain or discomfort, and this anxiety keeps people from getting necessary treatment. So in today's segment with the trusted team at Lifetime Dental Care, we explore their methods of helping people relax. I'm joined once again by Drs. Beth Love and Dr. Rick Berry of Lifetime Dental Health. Welcome back to both of you.
Thank you.
Great
Glad to be here.
It is the number one, anxiety. Beth, you know that as well, but it's also a game changer in that now you have some options for people. Can you explain in a nutshell what sedation dentistry is all about?
Well, this is going to be hard to believe by a lot of people, but dentistry can be completed in a safe, comfortable, and relaxing environment, even if our patients have anxiety or they fear the dentist. So sedation dentistry is going to make your dentistry comfortable. We can do it completely comfortable. We can do it effective and efficiently. But most importantly, the patients won't remember or be aware of the sights, the smells, and the sounds. Sedation dentistry is a way for our dentistry to have the dentistry that they want and they need and be completely relaxed and at ease.
And I would think, Dr. Berry, that helps you as a dentist as well. If you don't have a patient who's so anxious about things, you can really do your job to help them.
Oh, it really helps. When they're relaxed, we're more relaxed. So
right.
we can deliver a lot of dentistry in a short amount of time. And when I talk to my patients about sedation, the first thing they say is, well, Doc, are you going to knock me out? And I said, no, it's not like a general anesthetic. It's a conscious sedation where you are awake, but you're so relaxed with the medications that we give that you won't remember anything. You probably can still swallow on your own. You can breathe on your own, and it's very relaxing for them.
Is this an IV sedation? Is this a pill? What is this, Dr. Berry?
Well, it's a pill. It's a prescription medication similar to Valium. We use a number of different types similar to Valium, the same drug class. And what that will do is it'll just totally take their fear away and allows us to, like I say, do as much dentistry as we can.
And Dr. Love, you mentioned that people won't remember the sights and the sounds because for some people, if they had a bad experience, that's what brings the anxiety to the forefront.
Absolutely, and that's what we try to do with sedation dentistry. We administer medications orally that take the edge off. Some it can be more profound. Sometimes we give a prescription sedative the night before so that our patients are guaranteed of a night of a good rest, and then they wake up relaxed in the morning. But something else that sedation dentistry isn't, it doesn't require the use of more needles because these medication is taken and swallowed whole, or it's crushed and then placed under their tongue by either Dr. Berry or I.
Well, it's interesting. You do have to have special education, additional education, in order to practice this way. Am I right?
Absolutely.
Yeah, we have advanced education, taken a lot of classes for it, and we've done countless sedations, so we're very comfortable and effective at doing it.
And what's the reaction of patients, Dr. Berry?
Well, it's interesting. I call my patients at night, and when I talk to them, one of my questions is, well, how long do you think you were in the chair? and they'll say, well, I think it was about 45 minutes or an hour. And the reality is we probably had them in the chair for 2 or 3 hours. And then they say, I don't remember a thing. I said, well, that's perfect.
That's exactly what you want to hear, right?
Exactly.
And this is for most people, any age, Dr. Love?
We deal basically with an adult population because there is some more specific training that you need to do with children. And so, yeah, but we can, I think I'm trying to remember my oldest patient.
Don't tell any tales.
Yes.
The person can drive to the office, Dr. Berry. They can drive home?
Well, and if we're using oral sedation, they have to have a caregiver drop them off and take them home and monitor them for a few hours afterwards.
Which is pretty normal, I would think. You feel a little groggy afterwards?
Yes. The types of medications that we use stay in their system for 24 hours so that we do ask that someone be with them for the rest of that day, and that we prefer that they not drive, within a 24-hour period because the drugs are stored within, and then they're spit out, if you will, back into the system at different times.
Well, Dr. Berry, we've had your phone number and email up there, but I suppose if someone does want to call, make an appointment, and they want this, they should tell you at that time when they want to make their appointment.
Absolutely. We'll be glad to talk about it. And, most of our patients that have this are raving fans. I mean, because we're able to deliver to a segment of the population dentistry they couldn't have had any other way.
Yes, that's wonderful. Good stuff, Dr. Berry, Dr. Love. Nice to talk to you. Thanks.
All right.
Thank you so
Thanks for
much.
having us.